a few tips if your kid has been diagnosed with Molluscum contagiosum. Hey, I'm Dr. G, a board certified pediatrician in mind with nearly 20 years of experience. And so let's get into this bumpy rash that's chronic. It may take a long time to go away. So first of all, it's called Molluscum contagiosum, and it is a common childhood rash that we see, and we can actually see it throughout the year. But this thing is contagious and it can spread. And here's one of the reasons why it spreads. It's because kids pick. That's what they do. When they see things on their body, they pick at it. When they pick at it, then they self-inoculate, meaning that they spread it to other parts of the body. So here's a few tips if your kid has been diagnosed with Molluscum contagiosum, or if they hadn't been diagnosed and you think that's what they have. Let's get into it. Number one, don't pick. Because if the kiddos pick and then they scratch somewhere else, they can spread it. Second tip, like if your kid has eczema, kids with eczema, their skin is already compromised. And so when they get molluscum, it tends to spread more quickly. So making sure you're treating the eczema, making sure it's under control is so important. And y'all, you may not want to hear this tip, but be patient. Most of the time, molluscum is self-limited. What that means in our world is that it'll go away on its own with some observation, but going away on its own really may mean months, and I've seen it in some kids up to a few years. Now, here's what you got to watch for, and if you see any of this, you need to talk to your pediatrician. If you notice these little lesions getting red and inflamed, that means that it may now be infected, and if so, you need to get treatment for that. So I hope this helps. Have fun this summer.